Case study, how good nutrition can help in treatment of uterine fibroids. Did you know that an estimated 80% of women have growths that are known as uterine fibroids? However, barely a quarter of them have growths that are large enough to feel or see. Essentially, a fibroid can be left alone, unless they develop problems. Most often these fibroids are discovered by accident. There are a couple of risk factors for uterine fibroids, with the exception of a family history of having them. In addition, African American women are more susceptible to uterine fibroids. The reason for this is not really clear. Having had a child and even using birth control pills decreases the risk of fibroid tumors, perhaps because of the reduced amount of estrogen in the body during these periods. In some cases the only treatment is a hysterectomy if the woman is finished having children or is close to the age of menopause. There are other, less serious means of dealing with them that should be explored before any drastic measures are taken. For some women, using birth control pills or other hormonal medications may be enough to deal with the bleeding, however it is not going to change the size of the fibroid itself and therefore will do nothing to deal with the pain it may cause. Other medications may reduce the size of the fibroid but may cause other symptoms. There is an ultrasound method for dealing with uterine fibroids, however it is not typically offered in all areas of the country and takes up to 3 hours to be completed. This procedure may not be covered by insurance in many cases, another factor to consider when choosing treatment options. Surgery to remove an individual fibroid can be done but will not guarantee that they will not simply return. There is another option called myolysis which involves using a laser or a special electric needle to destroy each individual fibroid. Again, there is no guarantee that the fibroid will not return following this procedure. The use of synthetic hormones may also be suggested but increases the risk of breast cancer when used for an extended period of time, so that must be carefully considered. In some cases, fibroids can grow large enough to cause back pain, stomach distension and constipation as they push the uterus into other areas of the body. A woman with a very large fibroid tumor may think that she is pregnant as well. If a woman does need to have a hysterectomy, she may also need to discuss the need for counseling afterward. Some women handle the surgery without a problem while others may find themselves depressed and overly anxious, especially if she is relatively young when it happens. In those who are still in their childbearing years, all efforts should be made to save the uterus if at all possible. In some cases, however, fibroids would prevent a viable pregnancy anyway. Foods that you should not eat. There are some foods that have higher levels of estrogen in them, which is what the fibroid lives on. These foods include red meat, poultry, dairy and eggs. Eggs can be a major problem because the chickens are typically fed a hormone so that they lay more often. If you cannot stop eating these foods, choose organic or certified hormone-free products instead. The label should clearly state that the food is either one or the other. Sometimes the label will indicate that it is both. What to eat. It is highly recommended that women who suffer from uterine fibroids consume extra fiber in soy or soy products. Fiber is necessary in the diet but sadly, most women do not get nearly enough. Fiber helps the body to process and eliminate unhealthy or potentially harmful substances including the excess estrogen that can be contributing to the growth of fibroids. Instead of eating beef or poultry, women who have fibroids are encouraged to use fatty fish like salmon and halibut instead. If you are a vegan or vegetarian and are consuming a specific diet, it is important to note that the body does get protein. But, you need to make sure that you have plenty of variety and consume foods that make up for the shortcomings of other foods. While the average diet gets around 13 to 15% of calories from protein, a vegan diet provides around 10% to 12%, the body is getting adequate protein intake, even in a vegetarian or vegan diet as long as there is plenty of variety to make sure that the foods are making up for each other's shortcomings. The average diet gets between 13 to 15% of calories from protein, the average vegan diet supplies between 10 to 12%, source, The Vegetarian Society. Vanessa and uterine fibroids. A case study. Vanessa is an African-American woman in her mid-40s. She has always had irregular menstrual cycles, even to the point of being told that she might not be able to have children. She did have two, a boy and a girl, but her irregular cycles continued. Shortly after turning 44, she started having heavier than normal cycles accompanied by an itchy sensation in her abdomen. At first she dismissed both as signs of menopause and tried to ignore them. However, the pain became worse and worse, so she finally went to see a doctor. The doctor discovers that she has fairly large uterine fibroids, which explains the bleeding and the pain. However, it is also the explanation for her recurrent back pains as one of the fibroids has increased in size enough to push the uterus back toward her back. She thought she had been gaining weight, but really it was caused by the fibroid. After some discussion, the doctor suggests that she have a hysterectomy, since she is finished with her family, nearing the age of menopause and the fibroids have started to interfere with her life. Fearing surgery of any kind, Vanessa asks to get a second opinion and talks over her options with another doctor who suggests that she try a dietary change. She cuts out red meats and other foods that have estrogen or other hormones. In place of some of the protein that she is cutting out, she opts for plant-based foods and a protein supplement, ProfectR from Protica. With this supplement she gets a full 25 grams of protein with only 100 calories with additional vitamins as well. While she is feeling better, the uterine fibroids are continuing to grow and she realizes that she will in fact need the surgery after all. After her surgery, protein, especially ProfectR, the supplement, will be beneficial to help her heal and get her strength back much faster. Using additional protein will also help her to not scar as badly and will help her immune system fight off any infections. She will bounce back from this surgery better than ever before.